week or two. There it is. We'll plan to send out the slides as well as the recording via email to everybody who registered for the event. If you do have any questions or even comments during the presentation or the panel discussion, do feel free to leave them in the Q&A, and we'll make sure to address them, and we will leave time at the end of the conversation for Q&A as well. So please keep those comments and thoughts and discussion items coming in. We really do welcome them. Next slide. I want to also give a special thanks to AmeriCorps, who administered the Social Innovation Fund grant that LISC received for Bridges to Career Opportunities, as well as the Citi Foundation for making this program possible. We know that there are many partners, both local and national, who supported Bridges over the years and were critical to its success. Other national Bridge supporters who we want to highlight include Citizens Bank, MetLife Foundation, Union Pacific, Wells Fargo, and State Farm. And now, next slide, I have the pleasure of introducing LISC's President and CEO, Lisa Glover. She's been our fearless leader since earlier this year, though a longtime member of the LISC family. I first met Lisa over a decade ago as she actually presented at our inaugural National Financial Opportunity Center Network convening as a major advocate and supporter of our work in her prior role at US Bank. We're so glad that she could join us today as she continues to lead and champion LISC's initiatives. And with that, I'll pass the mic to Lisa to kick off today's events.
All right, very good. Well, thank you, Song. That's very nice, and it has been. It's been that long since I met you. I can't believe that it's been that long, but it's been a great run. So, thanks for coming today, and I'm happy that everybody was able to join us. Just as some background, in 2005, LISC launched the Financial Opportunity Center, or the FOC as we call it, program. And FOCs were designed to support unemployed and underemployed residents of our communities to attain upward economic mobility. So using a multi-pronged approach that includes financial coaching and access to financial supports, the FOC model immediately showed promising results. But our experience with FOCs also showed that sometimes these tools weren't enough to move our clients towards permanent financial stability. Low-wage jobs and the lack of skills to improve the potential for earning a higher wage was also an obstacle. So the Bridges to Career Opportunities initiative was developed to build on the success of the FOC program. And after a small-scale pilot, LISC received a Social Innovation Fund award to scale Bridges to over 30 sites. Based on the success of that program, then the Citi Foundation invested in the the Bridges program with a $10 million 3-year award to 40 sites in 19 LISC markets and 2 rural locations. That was a huge commitment. So today, Bridges serves over 2,000 people each year, largely from the disinvested communities of color that we serve. Job seekers can engage in basic education and technical training on their way to attaining an industry-recognized credential. And along the way, our Bridges partners provide the financial coaching, the career counseling, and some economic income supports that help the participants avoid the obstacles that often plague a successful completion of their chosen program. So these services through Bridges continue even when the participant has begun a new job and advances in their career. And I can tell you that this program has had excellent results. So the Citi Foundation grant enabled us to have 5,800 people complete Bridges, 4,200 people received an industry recognized credential, and 3,400 began a new job. So that impact is really tremendous. And it's a great example of how partners can come together to make a difference in people's lives. So again, thank you, Citi, for your funding. Bridges also aligns with LISC's strategic vision to address the racial wealth gap. So access to good jobs with room for advancement is a requisite for individual financial stability and for the health of our communities. Bridges creates that pathway to family sustaining wages and careers with opportunities for growth. So as I mentioned earlier, and as Sung also mentioned, Bridges was made possible due to an initial grant from the Social Innovation Fund, which also supported the impact and implementation evaluation of this program. So an external evaluator, Abt Associates, has led our evaluation efforts and is now going to take us through the results. And Judy Allenpraise is a principal associate at Abt and has deep experience in directing research, evaluation, and technical assistance. So for 18 years, she's led Apt's learning or adult learning practice. So with that, I would ask you to please join me in welcoming Judy.
Thank you very much, Lisa. Let's go to the slides, please. Next slide. It's a pleasure to be here today to share the highlights of the findings from Abt Associates implementation and impact evaluation of the Bridges to Career Opportunities initiative. I'd like to first acknowledge the work of Apt's researchers and statisticians who were part of the evaluation, since it was really obviously a team effort. Next slide, please. The focus of the evaluation was the Bridges to Career Opportunities model, which is shown on the slide. And this model has 4 components. The first is the contextualized bridge services that include career awareness, instruction and foundational skills, math, reading, writing, decision-making, problem solving, that is contextualized to occupations so that participants can succeed in occupational training that is part of a pathway. The bridge services result in clients earning credentials and entering jobs with a potential for upward mobility. Another component are the income support services, and these include enrollment in public benefits that can provide support for daily expenses and reduce barriers to employment. Next is the financial coaching and education, which are expected to help clients reduce expenses, access credit under better terms, increase savings, and build assets. The assumption is that financially stable clients will be more likely to engage in and remain in training. And finally, the 4th component is employment services. And these include employability skills, job readiness, and job placement that can lead to a job that has potential for advancement in a career path. So these services are expected to lead to short-term and longer-term outcomes. And the assumption is that the 4 services work best when they are integrated in a model. Next slide, please. In the evaluation, we examine the outcomes of the clients who participated in the Bridges model compared to clients who were enrolled in LISC's financial opportunity centers, which offer the same services except for the Bridges component. So we wanted to examine whether the bridge services with contextualized foundational skills and occupational training that would enable clients to earn credentials would result in stronger outcomes for clients in employment and financial well-being compared to those clients who did not receive the bridge services. Next slide. So the evaluation involved an implementation study and a quasi-experimental impact study. The implementation study investigated to what extent the bridge services in the community-based organizations that were part of the study delivered the 4 types of services in the model as they were specified. The quasi-experimental study assessed impacts on employment and financial well-being. For employment, we examined whether Bridges participants were more likely to obtain or advance in a job after the program relative to a comparison group who received only financial opportunity services. And for the financial well-being, we examined whether Bridges participants were more likely to have obtained or increased their credit scores after entering the program relative to a comparison group who received only FOC services. Next slide, please. So we looked we purposefully selected 7 Bridges programs that had strong implementation of the Bridges model, and that had projected enrollments that would be sufficient to participate in the evaluation. We conducted a content analysis of all the information that we received from two in-depth case studies where we interviewed staff. We observed the activities that they were providing, and we then rated the adherence to the Bridges model based on that information that we received in, during the implementation study. We selected then 6 comparison sites from the FOC, Financial Opportunity Centers, who had demographic characteristics that were similar to the 7 treatment sites, and that had roughly the same level of education completed for clients and employment status and credit scores. And we verified their services in terms of their employment and their financial well-being services through a series of telephone interviews. The quasi-experimental study looked at both, as I just said, employment and well-being outcomes. We used the Corson exact matching method to match Bridges participants to participants in the comparison group. And then we analyzed participant outcomes using a linear regression model that tested the effects of Bridges on job advancement and credit score increase. Next slide, please. We had 7 treatment sites and then 6 comparison sites. Next slide. And to give you an idea of some of the characteristics of the comparison, the treatment participants, we found that they were mostly female. 1/3 were between the ages 25 and 34, and 1/4 were younger than that age. Half of the participants were Black or African American non-Hispanics. More than half were single or widowed. Next slide. 41% were employed when they began Bridges. And in terms of their level of education, half had a high school diploma or equivalent when they entered, and almost 1/4 had some college. Finally, we looked at their FICO scores, which is the credit score rating, and we saw that 40%, almost half actually, had a rating of fair or poor, and another 1/4 had insufficient financial data to be rated as a score. So obviously they were, below what would be considered good or exceptionally very good in the FICO score. Next slide, please. So I'd like to give you just a few highlights from the implementation study. So in terms of Bridge services, you can see just by the numbers of bullets on this page that the Bridge services are very comprehensive, and we were wanting to understand the extent to which the treatment sites, Bridge services, had all of these following features. And we found that the primary pathways that the Bridge sites were implementing were in healthcare and child development. The Bridges approach included contextualized foundational skill courses that led to occupations or that were integrated into occupational training. So there were 2 variations there. And the occupational training included partnerships with community colleges and with training vendors. At the end of Bridges, clients were prepared to take occupational assessments and enable them to earn an occupational credential, or they were rewarded a program certificate of completion, or they were qualified for entry into an apprentice program. Their career coaching that they received involved information on pathways and also verified that their desired occupational training was a good match for them. Next slide, please. The financial coaching and education services focused on having clients complete a financial assessment. There were regular interactions between clients and coaches, and those were client driven. And then the clients reviewed their credit scores every 6 months. From that, we found that financial coaching and education services were in order to do those, it was very important for coaches to establish a strong relationship with the clients so that the clients felt comfortable sharing financial information, and tracking their financial progress was actually one way to keep clients engaged. Some programs also offered group financial education workshops that were conducted by local banks and other financial agencies or partners. Next slide. The other component I'd like to talk about is the employment services. These included job preparation, job search, and coaching on retention and advancement. The strong employer relationships were critical because the goal was that employers would agree to interview the Bridges program completers as they were ready to search for employment. Also, I think a distinctive feature was that employment preparation began very early in Bridges, so that the clients were able to look at their past work experience, develop their resumes, think about strategies and what employers they would be interested in at the beginning, so that by the time they were ready to begin the job search, they were well prepared. Next slide. When we analyzed all of this implementation data, we found a very strong adherence between the activities that the Bridges sites were implementing, and all those activities you just saw were specified in the Bridges model. So roughly almost 94% of the Bridges services we found were present when we analyzed the implementation data, 95% of the employment services, and 94% of the financial coaching and income support. So that is considered very strong adherence to a model, and really reflects on, I think, the wisdom in having a very specific model for grantees to follow, and the amount of technical assistance that LISC has provided to local grantees in understanding and carrying out all of those activities associated with each of the components of the Bridges model. Next slide, please. So we examined two impact study questions. One that the employment was, were they more likely to be employed or advance in a job? And the financial well-being question was focused on more likely to obtain or increase the credit score. Next slide. So when we looked at the impacts on participants' job improvement, we found that there were significant differences between the BCO participants and the FOC participants. The Bridges participants were 18 percentage points, almost 19 percentage points more likely to have obtained a job advancement when compared to the Financial Opportunity Center clients. So that was a key finding. And what the assumption had been through this model is that through obtaining further educational credentials and job training, they would participants would be better positioned to be able to get jobs and improve their jobs. And that was actually confirmed in the study. Next slide, please. We also looked at the impact of Bridges on credit scores. And what we found was no significant differences, but that the financial opportunity centers, a higher percent of them were able to increase their credit score compared to the Bridges participants. We looked at some possible explanations for this, one of which is that because of the length of BCO program, the BCO participants enter employment after they enter the BCO program, or the Bridges program rather, later than the participants in financial opportunity centers, because the financial opportunity centers folks enter those services with the goal of getting employment as soon as possible. When the Bridges clients enter they enter with the goal of participating in education and in occupational training, which then lengthens by usually 4 to 6 months the time it would take for them to complete those programs and be prepared to enter. So that that length of employment may be one factor affecting the differences in credit score increase after program employment enrollment. Next slide, please. We also then looked at education outcomes for Bridges components only. So these are outside of that impact study model. And we found that 86% of the Bridges participants completed their education and training, which is a very high percentage compared to some other programs that are underway that involve education and training similar to that is offered through the Bridges program. And next slide, please. We also looked at education outcomes for Bridges components and in terms of the number of credentials that they earned. And we found that, let's see, I'm trying to read the slide here. 80% obtained at least one credential. 18% obtained 2 or 3 credentials, and 2% obtained more than 3 credentials. So again, number of credentials was a very positive outcome. Next slide, please. And finally, we looked at the types of credentials that were earned by the Bridges participants, and most of them were either in healthcare, which was 57%, or child development. And both of those entry-level jobs are relatively low wage jobs. So when we looked at the economic advancement of the Bridges participants, it is not surprising that some of those the lower credit score, for example, may be due in fact to some of the wages that the participants were earning in these 2 particular areas of occupational areas. We also did have some occupational training outcomes through the NIMS manufacturing, a small group with hospitality, in business technology, and then there were some ancillary certificates that were shorter term certificates that the Bridges participants earned along with their occupational credentials. Next slide, please. So what did we conclude from the study? One is that community-based organizations, who were the implementers, can really implement a very complex multi-component model such as Bridges with strong fidelity. And I think part of that is due to obviously the types of organizations that are participating in the whole Bridges program, along with the specificity of the model that has been able to guide them in their services, and really very well-functioning organizations who work to integrate services in a very positive way for the clients that they serve. The majority, most of those clients earned their educational credentials, and then that led to employment advancements. So we can see that both earning educational credentials and advancing in employment is achievable through the use of the Bridges model. We also see that Bridges education employment outcomes can lead our steps toward economic well-being, but that increasing economic status is really a very complex process. It's affected by many factors, in addition to educational credentials and training, and that it's longer to achieve. I think we have, researchers always end with the issue that you need more research on what's next. So we really want to understand more the nuances, involved in increasing economic status. So let's go to the next slide, and we are ready to begin with our panel. So we are, it's my pleasure to introduce the members of our panel who will share their thoughts about the evaluation's results and their implications. We have Brandy McHale, who is head of the Citi Community Investing and Development and president of the Citi Foundation. And Brandy has really a lifelong dedication toward initiatives that connect low-income communities and communities of color to jobs, housing, and more secure future. Welcome, Brandy. We also have Tondaleo Hall, who is the Director of Financial Stability Programs at the Wesley Community Center in Houston. And Wesley was one of our Bridges treatment sites in the evaluation. Welcome, Tonda. And Song Kim, who is the Vice President of Economic Development, who has been an active partner in the evaluation, providing insights and context for all of our work. So I'm going to begin with my first question, and I'd like each of you to respond. And that is, what findings from the evaluation resonated with you? And Brandy, we'll begin with you, please.
I think first and foremost, I think based on these findings, the program works. Okay, so we take that as our beginning point for the effort. And it is, I have to say, as a funder, it is so great to know that we're investing in something that does work. And we also didn't provide dollars over a long-term period so that there could be an opportunity to make some tweaks to the program to provide some flexibility to organizations. So I will say that the program works, but it's not necessarily easy. This is hard work. So I want to acknowledge and thank all of the practitioners and Tondaleo and you and organizations like your own that are really the champions in this space. The couple things though that really jumped out at me. First, I have to say, give a shout out to the women. 90% of the, significant proportion of the participants in this program were women. Why does that matter? Because we know from other research that when women increase their earning power, they reinvest it back into their family. So another piece of this is that it works, but who does it work for? This is working for families, not just for individual workers. And when it works for families, it then works for communities and it works for economies. The other thing I'll point out is that I did not know until we saw these evaluation results that so many of the participants had a high school degree and 40% either had some college or a college degree. So there's something going on, which we know in the economy and the workforce, that where it's not just jobs are changing and the employment outlook is changing, but also it's not, I don't think it's coincidental that such a high proportion of the participants were people of color. So I think there's something here that really resonates for me that says, we need to pay attention to that specific connection. And then the only other thing I'll just say that really resonates for me about the study is and the whole initiative is that, the data is important. It doesn't always tell the full story about people's lives. People's lives are complex and are complicated, and there are a lot of factors that lead to the, that can derail or enhance the outcomes that we're looking for. But the thing that resonates the most, though, is that we do have data that's telling us we're on the right track.
Great. Thank you, Brandy. Tonda, would you like to give us your thoughts?
That the biggest takeaway for me was that for those individuals who actually completed the training, that the healthcare wages weren't as high as we expected, right? Because we invested a lot in the training component. There were even times where we provided stackable credentials where we felt that clients would be more marketable in their industry, specifically in healthcare. And the wages were a little bit lower than we anticipated. So we looked at that return on an investment and where we thought that individuals were more marketable. And that was a great starting point for conversations. And I'll talk a little bit more about that a bit later when we discuss employer relationships and the champions around workforce development and how we begin to take a look at that and the competencies that clients need as they enter the industry to make them more marketable and have a value added for that employer. And so that was like one of my biggest takeaways and surprises from the data.
Great, thanks, Tanda. Sung.
Thanks, Judy. Yeah, I have to say, though we didn't get the complete win on the credit score outcomes for some of the reasons that you mentioned, I was still very impressed by both groups having received financial coaching and experienced strong credit gains. And the win in job advancement and improvement were also affirming. It really did affirm the importance of the holistic services that we promote, particularly as we consider how critical these services are going to be in the future, right now and in the future as we think about achieving equitable economic recovery. And the other item that I want to call out, the one other finding is just how we have a promising and replicable strategy that our community-based partners can really tailor to fit the needs of their unique and distinct populations. I was so impressed that our partners were able to deliver the Bridges model with such high fidelity, and it's really a testament to how dynamic they are, that they were able to really adapt this intensive multi-pronged approach in a way that fits the community's needs. And I also want to acknowledge that the program replicability can also be attributed to our local LISC offices who provide some of that accountability and support around the program. Sometimes I reflect back on the models and the structures that we've created over time, and it can feel complicated, but the reality is that the challenges that we're up against are complicated, and we've found some solutions that are replicable and that can work. So I'm really thankful to see these results.
Great, thank you, Sung. So Tanda, what are some of the key elements or innovations that you think have made the Bridges initiative successful?
So I think it's sort of what Song just alluded to, really having a sustainable model that you can pull together in order to meet outcomes and basically meet the clients where they are. We married the Bridges program with the Financial Opportunity Center component. That coaching component is what's really critical for our clients, meeting them where they are and being able to address those various areas of their lives. It's a holistic approach to really help them get to where they need to be. We have our cheerleaders, which are our coaches, that really help connect with the clients over time. And it's really all about that relationship building and connecting with them and making sure that the clients stay in the driver's seat. It's all about what they want and what they're looking for. They're driving their decisions around their employment, around their finances, where they want to supplement with their income, with income supports. And that coaching component is really what's transformative for the clients. In addition to that, I would say the employer engagement strategies that we've implemented. It started off, with us working with one particular hospital, and now we've grown and have worked with multiple hospitals, major hospitals in the area. And being part of the world's largest medical center here in Houston, it really makes a difference. And having those forerunners in the healthcare industry where we can connect with them and find out where there is skills gaps and where there's opportunities for, building on these core competencies and skills, the employability skills, having them at the table to make conversations. Now we have evolved and gone from just doing employer-led projects where individuals were assisting us with the interviewing, running special applications for us so that they know exactly who our population is, coming in and doing lunch and learns and presentations so they can meet and greet our clients beforehand, along with that mock interviewing. We now have them in a venue where they convene and meet with us on a quarterly basis as employer partners and talk about industry trends and what the local labor market is looking like. And in terms of acquiring that talent and what they're looking for when they're hiring, as well as attempting to retain their staff. We want to help them tackle that high turnover. And that will help us over time see the wash out of of greater financial stability and outcomes because we're able to help them retain those staff.
Thank you, Tanda, very much.
Mhm.
So, Brandy, how can investors and supporters of economic opportunity initiatives like Bridges help advance this work and make it easier to implement in the community?
Well, this probably applies to any type of program or, nonprofit organization. I mean, first, investors can make it easier by recognizing that flexibility is absolutely critical, and also trust. We at the Citi Foundation, Tanda knows so much more about what's happening in the community she serves, but what it takes to actually win over hearts and minds, to engage people, to retain people. We don't know those pieces ourselves. So one is really come at this and say, provide flexible dollars to local entities that really are trusted, and in turn we need to trust them. They are not trusted just because their name says we're a 501c3 nonprofit organization. I actually wish it was that easy. They're trusted because of a track record that they have of delivering day in and day out and being there for the people who are at the most risk of being left behind. So one is, I would say this applies to any funder in any space whatsoever. I think, though, what's interesting about this program is that whether it's a public sector funder or a private foundation funder, we often get very caught up in, well, what's the cost of the intervention? What's the cost per participant? What's the cost benefit analysis that we're going to see? And I think we have to move away from that type of one size fits all approach. As we can see in this program, we have in this study pretty motivated individuals.
Right.
There are people that would different levels in terms of their skill set, but more importantly, their connections and their confidence. And I think that as funders, one of the things that we discount or we don't put enough of a price tag on is, even if someone didn't complete the program, what are the gains in their sense of self-efficacy and their belief in themselves? It's not a fail. The only fail is probably are not trying to reach out and trying to sort of, only go with individuals that we think will have the best chance of finishing the program. And in part, that's because I think funders approach this, there's this strange incentive for organizations to say, no, we have to show success. And so as funders, I think we need to broaden how we think about success and how we think about, to me, empowerment and that belief in yourself and that I belong is just as powerful of an outcome as the wage gains. I think the other thing here, and Tanda mentioned this, I think this is really important. When we went into this, initially structured the program, I don't think we understood how much care and effort it was going to take to actually engage employers, not just to get them to be clear about what jobs they needed, but to really get them to be partners in this process and provide both the information that was needed, the supports that were needed to the workers that they were hiring, and just support to create that partnership between the community-based partner and the employer. And I think that, again, we often don't factor that in. I bet you, Tanda, if we were to really sit down and look at the actual hours that were spent by your team in running this program, there's probably a lot of unfunded activity that went on. And so I think we need to fund programs and think about the whole ecosystem as opposed to small, individual pieces of the pie.
Brandy, I have a kind of a side question. One of the things that really does distinguish the Bridges model is the inclusion of the financial well-being services. And you come from the financial industry. Can you just give a couple of comments about when you saw this model, and I know you've been involved a long time, what really caught your interest about doing that early on in terms of, the types of models that have been around and how they've done that?
So it's really interesting because in the financial inclusion or in the asset building space, we focus a lot on, I think about household family balance sheets, and we really focus on your expenses. How are you managing your money? What are you doing? How much are you saving? How much debt do you have? We have to think about that side of the balance sheet as well as the income side of the balance sheet. And this is one of the first large scale programs that really brings these two things together in this unique way. It's actually pretty common sense, right? You've got to think about your revenue and your expenses and your savings for a rainy day. It's actually not that complicated of an idea, but as funders and practitioners, we have sort of these siloed fields. We've got workforce field, and we have the financial empowerment, financial education field. And they don't always come together. So I think this is really unique. I think it's really important. We've got to help people earn income and maximize their income through really strong financial management strategies. The other thing I'll just say is, the coaching model is really unique. And this isn't telling people this is where you can get a job. These are the services you can apply for. This is, again, fundamentally about empowering people to believe that they can set a goal and they can attain it. And that coaching model is fundamentally, I think, the secret ingredient in both the employment side and the financial capability and side and the financial outcomes as well. So what a great thing, for us as funders is to think about not just, what the results are, but how are we working? And I think we need to really look at this coaching model and see how it can be applied in many other spaces.
Great. Thank you very much, Brandy. Okay, so what are the levers to scale this work?
Absolutely, that's one of my favorite questions. But before I answer that question, I do just want to underscore some of the things that Brandy mentioned around some of the less quantifiable and measurable outcomes of the program related to self-efficacy, self-confidence. People come to the Bridges and Financial Opportunity Centers and they build social capital. They find a level of hope and confidence that helps them to be successful and to pursue their goals. And you're absolutely right in that so many times programs, nonprofits are disincentivized from serving people with the highest barriers. And that really does need to change if we want to think about how to make the economy at large more equitable. But in order to scale this set of work, and I think I heard Tanda and Brandy actually allude to this as well, we really do need to elevate the role and access of communities in the broader workforce development ecosystem to ensure that these ecosystems are being designed with deliberate inclusionary practices. The work cannot be done without the integration of nonprofit workforce organizations who have deep roots, who are deeply embedded in their communities, and who take the time and the effort to use evidence-based models to address the whole individual and their families as well. The goal of our Bridges programs is not just quick job placement. We are looking for long-term transformation of people and of systems to support community resilience. And that does require long-term relationships, it requires long-term investments, and it requires long-term programs as well. And again, that requires the long-term sustainable funding that we just heard a little bit about. We also, as a LISC, we also need to think about how to broaden our scope and our reach with this effective program model. We need to think about how we're influencing community colleges to offer stronger student supports through their work. There should be more quality skills training programs that are offered pre-release that embed both skills training and financial coaching within correctional facilities. We have to think about how services are integrated in affordable housing, reaching clients where they live, through the housing authorities. We need a stronger focus on holistic and culturally competent services that are being delivered through federally funded American job centers as well. And we need to think about, as a LISC, we also need to think about how we might broaden our reach into different types of nonprofit organizations as well, including those that might work maybe more so focused on issue areas such as safety and justice, in arts organizations that I find often look for creative and really wonderful ways for people to earn a living and express themselves and build that confidence. And we also need to think more about organizations investing in those that also promote entrepreneurship as well. And I'll also say that we need better integration of workforce and economic development strategies, to Tanda's point, that include those stronger employer connections that will inform these programs that really promote worker success. So we recognize, and something that I've been thinking a lot about lately, is that community nonprofits cannot scale this work alone. We really need to change the systems to increase opportunities for workers. And that means stronger practices amongst industry, amongst the private sector. Employers who are invested in their people, their employees, who will offer on-the-job training where people are actually paid to upskill, as well as using skills-based hiring practices, acknowledging that all people do not have the same access to college degrees. And we need to be really intentional about advancement strategies so that people have a clear pathway, not just to get onto that first entry-level job, but really to consider how they're going to advance along their career path if we want to retain people in the workforce long-term.
Right.
If it's okay, I just want to jump in and say, I think this issue of mobility is so incredibly important. I mean, when you hear people say, I'm stuck, ultimately what we want to do is help people feel, never feel I'm stuck. There's no place for me to go. It is so disempowering. And I think that sense, and that we need to think about, again, not just the success being, did we get people into jobs, but do they have the ability to then either move within that career path, or also other things, like do they have skills that allow them to potentially move into another community, or maybe they have more social capital, but they're stuck, right? Because they're like, how can I do that? So I don't know, it's I don't know, Tanda, we have to come up with like the Unstuck Initiative, something, but I think that there's something there, and that when we think about scaling these efforts, it's not just scaling the number of participants. Maybe the word is, how do we also understand the multiplier effect and how we think about longevity as well? So it's both scaling, and it's multidimensional.
So, Brandy, what do you think the role of lifelong learning is in all of this? Because to your point, if you may need to go back to school, or for further training if you want to advance, and people coming back, as you saw the demographic characteristics, this is a big step to come back at this point to go into the Bridges program. So there needs to be, do you think there needs to be, for all of you, some building within the program, the expectation that advancement may in fact involve more external learning?
Well, I'll tell you something that just sparked for me in asking this question. So we just made an investment in a for-profit company called the Mom Project, which specializes in helping women who have been out of the workforce to return back to the workforce and to get that start and to get themselves back in again. And it's interesting because one of the things that comes up is not, I don't have the skill set. It's just, I no longer have the confidence and the comfort to be able to do it. And I do think that this concept of lifelong learning, I think those words are actually pretty intimidating. And it's not that you have to learn new skills to get a job. Somebody just has to give you a chance sometimes. And so maybe we don't think about it as lifelong learning on the part of the learner, but we think about it as, lifelong experiences and lifelong, then people are creating opportunities for people with lifelong experiences. I just think that it can be very intimidating, certainly when, look, I know myself, I was the first in my family to graduate college and the first in my family to work in a large corporation. I still to this day remember how I felt the first day I walked into the bank and, was like, what do people do when they get hungry? Like, when do you eat lunch? Like, what do people do? All those hidden questions. So I just, sparks for me that this isn't just an income, issue. The concept of thinking about people along their entire life cycle, but this is really a critical shift we need to make.
So the next question is, what policies or systems need to change to support adult learners of low wage, adult learners or low wage earners? So Tonda, why don't you talk about that one next?
Yes. So one component I think is around public policy, just changing policies and systems around employment, right? In terms of the wages that we're paying, or also maybe supplementing the bridge with stipends. For example, I've had a client come in just recently. We were celebrating because she got a new job. You know what she said to me? She said, it's only paying $11 an hour. I wish I would have gotten a job paying $15 at the retailer up the road. And so clients make these decisions around, like, going after your passion. That's critical. But the reality is that people need family sustaining wages. They need livable wages. They need to be able to take care of themselves and their families. And having to make choices about your career based on what's paying. I think it's, I don't want to say inhumane, but almost inhumane not to pay people at a certain level where they're working so hard in order to achieve their goals and to take care of their families. And so I think there needs to be some change around that. With that being said, this also brings up implications around public benefits. So there's this benefits cliff that a lot of us talk about. People get to a certain point, many of these low wage jobs push them up to a point when it comes down to promotions and advancements that they have to make a decision as to whether or not they want to take the promotion or advancement and jump off the cliff, or lose that safety net that they have around their SNAP benefits, around their not TANF, but around their childcare subsidies or their healthcare benefits. And so that can really be a challenge as well. So if there's a system change, because even a dollar can make a difference. I can remember working in programs previously where I had to tell people that they were ineligible because they were off by pennies. And so that can be devastating for someone who loses that, or even their subsidized housing. A lot of people make choices not to take promotions due to the fact that they're going to lose their subsidized housing or Section 8 housing. And so I think that there should be some change around those two issues as well.
Great. So why don't you go next?
Sure. Actually, I'd love to just build off of what Tonda said around some of the policy solutions to possibly mitigate cliff effect. I ran into the same issue with one of my financial coaching clients from 15 years ago, who I still keep in touch with today. We had the opportunity to get her into a better paying job. She was earning at that time in 2006, $11 an hour. And we actually got her a job as an office admin, making close to $40,000 an hour. At this time, I had very little knowledge of the benefits cliff or what real so many hardworking Americans, particularly working moms, faced. And it was through that I began to understand that even though we got her a much significantly higher paying job, she actually really was, at the end of the day, not that much better off because of the loss of childcare subsidies, because of the loss of just housing vouchers and other benefits that she had accessed before. And honestly, when we went through our first decade of Bridges, our average wages were relatively low, and we didn't come up against this issue very much. I would say that it's just been in the last 4 or 5 years, particularly 2018, 2019, when we've been promoting Bridges work and also trying to integrate more strategies around retention and advancement coaching, that this issue started to emerge again, when people were going from earning $14 or $15 an hour to maybe the opportunity of earning 17 or 18, and really refusing raises or promotion as a result, which just absolutely makes no sense at all. So I just want to underscore what Tanda said around really needing to revisit the cliff effect. And similarly, if our goal is to help people advance economically, we saw this past year how important it is for people to be able to build assets, to have savings, a financial cushion. We need to get rid of the asset limits for certain benefit recipients similarly, so they can build and save assets and consider what their future goals and options are without penalty. So those are probably the big ones. And one other that I'll just plug, because as I think about how the pandemic has shifted the future of work, how it's accelerated the need for digital skills, I would also love to see stronger policies to encourage digital access for all. It's not just an issue in rural America. Even in our urban markets, there are so many individuals who do not have appropriate digital access within their homes, with which they could have attached to online education and training, and that we know are extremely critical to all positions of the future or positions of the now. So in order to ensure that people, and particularly people of color, have jobs to go back to who are going to be able to benefit from automation and from technology, we need to ensure that there is stronger digital access, and that can be done through affordable housing. I believe that Wi-Fi and broadband access should be as accessible of a utility as running water and electricity, and we need to figure out how to make it as such.
Great, thank you, Sung. Brandy.
Judy, I can never follow Sung whenever she gives an answer like this. I won't forget this. No, I'm going to just say, obviously, my co-panelists don't disagree with anything that they've said. I do think a minimum wage, I'm a huge believer in the power of assets. I think people, I think the fact that we don't have emergency savings and that there's a disincentive to create emergency savings is really just bad public policy. Yeah. I also think that there's the asset effect, that when you're able to save, again, it just reinforces that sense of empowerment and your ability to look to the future. I think, again, underneath, I don't want to sound like a broken record, but the power of being able to not just live day to day is a game changer in people's lives. And it's really hard for people to make choices like, I'm going to be a lifelong learner, or I'm going to take a stretch job, even though I'm not 100% sure I can do it. Because when you're living in a day-to-day mindset, forget paycheck to paycheck, that's week to week. Things are talking literally day to day. You just can't look up, and the future just seems, talking sometimes in 24-hour increments. So I think we need to think about that from a policy standpoint, about the power of assets. The other thing I think we need to do, and this isn't a policy change, but I think the question was thinking about systems change. Yeah. And I want to get to two things. One is the power of storytelling and success stories. I am really concerned about this narrative that exists that says employers can't find people to work because they've gotten too many public supports over the past year. People are not getting rich off of their unemployment benefits or any special COVID payments that they receive. Absolutely are not, living a grand life. So this narrative, we have to work on shifting that narrative. about really making it clear, how are people making ends meet? You know, I don't think that we tell that complete story the way that we should. We funded a project a few years ago called the Financial Diaries Project, which tracked almost 300 families over an 18-month period to understand the financial inflows and outflows in their household. And the other thing that we don't talk enough about are that the familial safety nets that exist between friends and family and communities and churches that is not part of the formal system, but is there to help people get food, childcare, cash when you need it. So we do need to think about those things. And, you know, I would just say that the other, you know, systems change effort that we need to look at is, how do we look at incentives for employers? What a game changer it is when you find an employer who's like, wow, I want to make a difference, or, you know, they get it. Well, what if we thought, I don't know, what if this is just a, you know, crazy idea, but what if, you know, businesses that get tax benefits, tax incentives,
Right.
to, you know, to locate somewhere, have to hire people from the community. We have community benefit agreements. Why don't we expand those? Why don't we make those bigger? You know, thinking about, we had Paycheck Protection Program efforts. What if there was some extra benefit you got if your employees were from much lower income backgrounds? So I think we got to think about the employer piece as well.
Great, thank you. So I have a closing question for each of you. Tanda, what are the lessons from this work for practitioners in community-based organizations?
I think there are a lot of lessons that we learned from this work. One, I want to talk about something that Brandy and Song both hit on, is talking about the confidence, the self-confidence of the clients. That is something that we actually saw, that clients just needed to be encouraged and empowered. And so we brought in speakers and did this also with our team, where we helped build self-confidence through the coaching model that helped build self-confidence when they celebrated the small wins based on what they desired and how they pursued it. And, you know, they were bite-sized steps where they could actually achieve those goals. That helped build their self-confidence through that coaching model. In addition, I would say we learned that we have to continue to do the work, right? Because the entry-level jobs are a starting place and they're a great stepping stone. There are many high growth, high demand jobs out there. We also need to make sure that there are promotions and advancements for these clients that are seeking a career pathway in healthcare as well as child development, and working up that ladder so they can obtain that upward mobility. And so upskilling individuals who are working in these settings, finding out exactly what is their trajectory and where do they want to go, and being able to pivot if they pivot as well. Because all of our clients don't want to stick with healthcare, we learn, or they want to switch gears and maybe not provide direct patient care, but they want to work on the front office or back office side of healthcare. And so being able to pivot with them in that direction as well. In addition, it's deepening those partnerships, not only with our clients, because it takes time to build a rapport with them and to really trust them, because finances is very personal. But that coaching model and continue to really focus on that financial coaching component, where we're looking at that net worth and net income and credit score increases and helping them with asset attainment, I think that's another piece as well. Maybe intensifying the financial coaching element in the beginning with the bridge work, not to make it overbearing for our clients, but to make sure that we're connecting more with them on that level and providing the coaching. So hopefully we can continue to get those outcomes. But I think a lot of that is going to come out in the wash long term with some of the clients as we help them with the upskilling and retention on their jobs. We had an opportunity to participate in another pilot, which was our 6 to 16 pilot or retention pilot. And it helped those individuals with that upskilling. And we did a lot of deep work around financial coaching as well. And so that's where we really work very closely with the employer partners. So the employer engagement piece is another piece. Again, continue to look at the sectors that we're focusing on and what the labor market data says, and really being able to drive those conversations with the community colleges and the employers and having all the community members at the table. I think those are some of the things that we'll really focus on moving forward, but we will continue to do this work and we're so excited about it. And we've given a lot of folks great opportunities. It's been a pleasure working with the clients and helping them pursue their goals. I thank goodness for the dream team that's been working with them. And it's amazing work. I thank you guys for making this possible for us to do the work that we're doing in the community. And I'm excited about the impact that we're making.
Thank you very much, Tonda. Brandy, what lessons does this work hold for philanthropy, particularly corporate supporters and employers?
Well, I think for corporate supporters in particular, but actually all funders, I think, we have to just keep thinking about support beyond the check. And, also live the values that we have in our funding. We need to live that in our own institutions. And so let's think about, we are employers ourselves. So if you're a corporate foundation, what can you do to try to create those job opportunities for Bridges graduates? What can you do to provide the mentors to Bridges participants? What can you do to help create that feeling of we're more alike than we are dissimilar, which is sometimes so important. We call the program Bridges. It's not lost on me that it's a bridge to something. And often that bridge is to a place that many have never been before. So what can we do to bring our people in to share their own personal experiences and their expertise, not just while they're in training, but even more importantly, supplement the coaching post getting that job and being there to provide that support system. I think we'll learn a lot. I think, frankly, as funders, we'll be quite humbled. And I think it would be an investment not only in the participants and in our grantees, but probably in our own self-efficacy and our ability to be more effective.
Great, thanks. Okay, Sung, what are the lessons for LISC and other national nonprofits?
Absolutely. I'll speak to LISC initially. The evaluation showed us that we did well, but there are areas that we can improve on. We can always do better. So we need to remain dynamic. We need to remain agile, ears open and ready to learn from participants, as well as our community-based partners who are operating these programs. One of the areas that I'd say we will stay the course is in LISC's promotion of evidence-based programs. We've learned through these tough third-party evaluations, and I'm looking at you, Judy, when I say tough, that we can be both people and community-driven as well as data-driven as well. And we do that in pursuit of finding solutions to improve our community's quality of life. The late and brilliant author and activist James Baldwin has said, not everything that is faced can be changed, but nothing can be changed until it is faced. So as effective as I'd like to believe our programs can be in helping particularly women and women of color, those with potentially facing higher barriers, but as successful as we can be in helping these individuals to get the job, pursue economic well-being, we have to recognize that nothing can be changed until it is faced, and we need to face and call out the existence of systemic racism, of implicit biases. We need to stand together against racial violence, which is a major source of trauma and a barrier in our communities that we cannot program away. And when we achieve strong levels of program completion and we recognize the amazing individuals who we come in contact with, who are able to advance over time, we have to recognize that it is their amazing resourcefulness and perseverance that they succeeded in spite of these injustices and inequities that unfortunately still exists today. I say this, I think every time I get a chance to speak in a public forum, I'm so thankful to work at LISC. I'm thankful to work on a program like this where we can work on making life a little better for individuals and families, and that I can work with colleagues who are also focused on affordable housing, community safety, health, economic development, education, childcare facilities work, and everything else that we know to be so critical to support economic well-being over the long term. So I'll just speak kind of as a national program and on behalf of LISC that we will continue to work on making systems work more equitably for all.
Great, thank you, Sung. I just have one comment, is that we learned so much from the site visits and, being on the ground and really looking at all of the fine work and really perseverance, both on the part of the clients and on the staff at making things work. And sometimes those characteristics don't get captured in our search for evidence and in, really wanting to focus on the numbers part of the story. But you do have to understand the conditions under which clients come to these programs. And each client has a different set of needs. And it is really very amazing how you can take a complex model with clients with different needs and harmonize all of that to make a really well-functioning program. So thanks to the three of you for very thought-provoking and excellent discussion. And I am now going to turn things over to Laura, who will look at the questions that we have gotten.
Great. Thank you all for a wonderful panel. I've been snapping and clapping in the background as I agree with you. It's been wonderful to hear. I'd like to just encourage anybody, if you have questions, to type them into the Q&A box or the chat box. We've got a few minutes now to be able to answer those questions. And the first question came in, and we're going to be bouncing around on these a bit, for Tonda, to really understand how you all at Wesley adapted to a virtual world when the pandemic hit and you couldn't meet face-to-face. And I think this might tie in with some of the challenges that you may have faced with the clients and how you addressed those over the last year.
First and foremost, I want to say we know for our client population that the digital divide is real. Many of our clients don't have access to technologies, whether it's the devices or the internet itself, as well as the know-how to navigate some of these technologies. And some people wouldn't believe that in 2021 if that's the case, but as you know, technology evolves very quickly and it changes all the time. And there was even a learning curve for our staff. Quickly, we pivoted, and when the pandemic arose, we shifted to virtual classes. Initially, we started off with pushing out a lot of education, simply because there was a lot of legislation coming down. There were a lot of changes. We wanted to keep our clients informed. There was a lot of things coming out around supports for emergency assistance, cash assistance. And so we wanted to help the clients there. And then we were able to get a bridge up and going. And so we provided a model that was somewhat of a hybrid model, where there was virtual work done in a classroom setting virtually, as well as some independent study. And we were able to implement various platforms. We use Zoom, Google's Classroom, Khan Academy, various platforms to facilitate some of that. We were lucky to get a number of grants where we were able to provide technologies to our clients, and they had access to Wi-Fi as well as access to Chromebooks or laptops. And so that was amazing. That was really a save for our program, what we were able to do. We did learn that virtual work is not for everybody. So we understood that. We did implement a technology boot camp. It started off a little short, and then we implemented an entire week of technology boot camp to help people get up to speed on that. And so those were some of the supports that we provided to get the work done. And we have adapted it over time. We will continue to offer work virtually. bridges as well, offer bridges virtually. And so we will continue to offer those in person as well as online classes, because it works for some of it in terms of transportation and childcare, especially during the pandemic where there was a lot going on. So I try not to get on a soapbox today, but in reality, people are dealing with life every day. Pre-pandemic, here in Houston, we had a winter storm that knocked out the electricity and heat, or electricity and all the amenities that we needed, and heat. Yes, it was during the cold. And so, which is not something that we're accustomed to down here. And just dealing with real life stuff. They were homeschooling their children, which is something totally different. They were sharing devices, which was very challenging because the schools did provide devices for a lot of the independent school districts. And they tried to navigate, still achieving their goals and working toward their goals. And so we were glad that we were able to supplement for a lot of those clients, but we knew it was difficult for many of our clients. And so we want to offer both platforms. Houston traffic is rough, and so transportation can be challenging, and navigating also work schedules. Like as the statistics alluded to, 41% or so of our clients were working across all of the test sites. And that's about average for our folks. Many of them are working as well, almost half of them. And so being able to juggle all those schedules, having the virtual work was really a help for them in some ways.
Great, thank you, I appreciate it. I'd like to build on that a little bit and have a question for Sung. Thinking about an equitable recovery and how that plays in with the future of work and the required digital skills that we know are so important to reach middle skills jobs. What are you seeing, or would you like to see as the Bridges model moves forward?
In an ideal world, digital skills will be a part of every one of our Bridges programs and our financial opportunities job readiness programs. And in an ideal world, every individual in every household will have access to their own personal devices and high-speed internet and everything that's needed to both participate in education and in the workforce. We all acknowledge that it's a problem. We know that last year during the pandemic, there were a number of programs that were out there that were giving away free laptops, that might have given away a mobile hotspot, but those did not reach every individual and they were not necessarily sustainable going forward. So I do hope to see that we, together with our partners, with our funders and our community-based partners, will make a stronger dent in providing some of those digital navigation skills. Tanda spoke to the fact that people might have a device, but it doesn't necessarily mean that everybody knows how to set up the Wi-Fi or to even know how to navigate different resources online, which really is the wave of the future. And that is potentially the silver lining of the pandemic, but we need still to provide more effort and support to ensure that everyone has that access equitably.
Thank you, I appreciate that. I'd like to turn now to a question for Judy. And this is just understanding how these results for this evaluation are fitting in with what you're seeing in the larger adult basic education field. You know, you've worked on many evaluations in adult basic education. What are the lessons learned here for programs and program design?
I think that, and Tanda spoke a lot about the holistic approach, as did Sung. And what we are seeing is that with the efforts to increase the integrated education and training that should be delivered in adult education programs, that really does suggest that the programs need to be concerned around the multiple needs that adults bring to the party, if you will. And I think this is clearly the wave of the future. And the adult ed programs have been doing this in bits and pieces over the years. But I always use the Bridges model, quite frankly, as an example of how you look at that across the board. And it will require additional funding for some of the programs because they're funded under Title II of the Workforce Innovation and Opportunity Act. And that is focused on instruction, basic skills instruction. So the question for them is, how do they broaden their services and work across agencies with community agencies, which a lot of them do, to get, additional funding to do the supplemental services and the like. So I think that this is the model of the future. I think that going in and just studying one thing for one purpose is not the way to do it anymore, because time is important. And when people have free time, they need to be able to address multiple needs simultaneously, which then puts them in a better position going forward.
Great, thank you. All right, I know that we have a few more questions that are in the chat box, and I would just like to say that we will be going through these and saving them and likely sharing more information in the next few weeks. We'll try and maybe answer these offline. We will be getting back to these. Now I'd like to turn it over to Sung Kim, who's going to just take us out from here. Thank you so much.
Absolutely. Thank you, Laura, and thank you to everyone for the really thought-provoking questions that you asked today. I just want to say again that this project would not have been possible without the support of AmeriCorps and Citi Foundation. And I also just want to acknowledge our lovely moderator today, Judy Allen Prezi, and her tireless efforts over the last 5 years and that of her team, as well as our partners like Tonda Hall, running these critical programs who've helped inform and refine this model, and who have taught lessons to LISC and through peer cert learning and supports to one another, so that we can continue to do this work better at each iteration. I want to give a thank you to all of our Bridges evaluation sites and our comparison sites. And a special thank you to our National Family and Community Wealth Building team with Laura D'Alessandro, who led our SIF Bridges programs, and Carolina, who took lead on data as well. And to all of the LISC, local LISC offices who lead the implementation of this work on the day-to-day with our partners, and to LISC leadership who've prioritized and supported this critical work over the years. Specifically for today's events, I want to thank Laura, Jess Boykin, Kenny Blake, Jackie Guzman, Katrin, and the LISC comms team as well, Liz Hale and Astrid Reedy, and others who worked both on content and event promotion. And I want to thank all of you for your participation in today's event, your partnership over the years. As I mentioned, we will share the recordings and the materials from today's event to all registration participants via email. And so thank you again. And now we can all get up and stretch after a good long conversation. So thank you, everyone.